With the rising COVID-19 cases in the country, the healthcare system is overwhelmed. And that means many patients can't be admitted in hospitals. Home care is becoming an increasing option. It used to be that it was only recommended for those who have mild to moderate symptoms, but these days so many are left without a choice. On today's program, we'll discuss what you need to do and look out for, as well as how do you set up your home to protect your loved ones. I'm Dr. Freddy Gomez, and you're watching MedTalk Health Talk right here on CNN Philippines. Hospitals in the National Capital Region are extremely challenged with the increasing number of COVID-19 patients. Joining us now are Dr. Aileen Cynthia De Lara. She's the chair of the Philippine Heart Association Council on Women's Cardiovascular Health. We also have Dr. Maria Victoria Pilares Cruz. She's the president of the Philippine Academy of Family Physicians. And they both will take us through the care you need while recovering from home. More than ever, we need to be super mindful about contact tracing. Kasi nga, the goal is to stop the spread of the virus. So if you've been exposed to someone who tested positive for COVID-19, home quarantine may be a requirement. Explain natin yan, Dr. Cindy. Ilang araw ba dapat naka-home quarantine at bakit?
The reason why you need to be on home quarantine is the fact that it would prevent community transmission. No? So, of course, these are individuals who had exposure to a positive patient with COVID-19, or maybe they are asymptomatic from the disease. That's why that's very important to have this on our setup, especially now that there's a lot of hospital being fully filled up with patients. So these are patients that has to be at their homes, that are isolated. So particularly certain things has to be inside the room to ensure that this patient would be well. The period usually is between 11 to 14 days, but they have extended it in some patients to 21 days.
And you need to pay close attention to possible symptoms of COVID-19. And the danger, of course, is when you don't have symptoms, but you're actually infected. Dr. Marivic, the question here is, at what point do you need to undergo a PCR test?
It's recommended when the patient is already manifesting symptoms, mas mataas yung chances na mapipick up na ng RT-PCR test na kung positive siya. So usually it's around day 3 to 5 that you have to undergo the RT-PCR test once you start having the symptoms.
That's why proper diagnosis is the very first step. Sabihin na natin that you tested positive. From home quarantine, we now shift to home isolation. Now, Dr. Marivic, let's explain the difference.
Yes, Doc Freddy. Isolation is actually for people who already tested positive for COVID-19. So kung ang isang tao ay nakapagpa-test na at lumabas na ang resulta na siya ay COVID-19 positive based on the RT-PCR, they are required to stay in isolation or to be isolated at home at least 10 days and to monitor the symptoms for the next few days. Yung quarantine naman kasi, these are for people who have come in contact sa isang tao na may COVID-19. So it requires you to stay at home for at least 14 days because during that 14 days, you will have to monitor whether you will develop symptoms of COVID-19.
A lot of people may be asking, what are the guidelines when it comes to isolating oneself? Dr. Marivic, will the number of days in isolation depend on the symptoms or severity of the condition?
Actually, the recommended number of days for isolation is at least 10 days, Yung sa quarantine, at least 14 days. Actually, mas mahaba yung period ng observation doon sa mga patients na na-expose because they have to stay in quarantine for 14 days. While those who tested positive for COVID-19, they have to be at least isolated for 10 days plus 3 days from the time that they are symptom-free. Because studies have shown na virus replication, hindi na sila competently nag-multiply after 10 days following the symptom onset.
Now, for those with mild to moderate symptoms, pwede naman to recover from home, but your local government unit will also be involved to ensure and that they can monitor your progress at home. Dr. Marivic, what are these symptoms that we need to be closely monitored?
Of course, the symptoms of COVID-19 are cough, fever, cold, sore throat, body malaise or body and muscle and body pains, fatigue, sometimes chest pain, which may be related to also the cough and a possibility of progressing to pneumonia. Kailangan i-monitor yung temperature. Kung meron silang pulse oximeter, ma-measure din nila yung oxygen saturation as well as nare-reflect din doon yung pulse rate ng patient. And kung may BP up sila, maganda rin kung may BP up. Yun ang mga kailangang nasa bahay para ma-monitor mabuti yung pasyente.
Okay, that's good you mentioned that because I'd like to ask Dr. Cindy, may certain setup ba na ideal para matugunan itong mga symptoms na ito?
Yes, Freddy. Of course, importante, it should be a solo room, no, for those individuals who are on home isolation or quarantine, no, ensuring lang that there should be adequate ventilation as well. Of course, a single bathroom that the individual should be using is also ideal, no. Specifically, syempre, of course, it is easily transmissible to family members as well. Of course, your supply is also important, so you should have your own utensils. Importantly, they should not be mixed, no, with all the other family members.
It's interesting that you mentioned, Dr. Cindy, yung kailangan talaga ideally na isa lang yung banyo at yun lang yung banyo na ginagamit ng isang taong who is in isolation. Pero what if the home has only one bathroom? What kind of recommendations can you do for those houses or those homes na isa lang ang banyo? How can they manage?
What you have to do is just clean, no, all the high-touch surfaces. So meaning doorknobs, flush ng toilet, what else, faucet. So every time you use it, no, so the ones who is isolated or home quarantine, after use, dapat nililinis niya yun. For the other person or the other family member, when he comes and use it, dapat lilinisin din niya yon.
COVID-19 cases are up, specifically in Metro Manila. Home care is an option for asymptomatic, mild or moderate COVID-19 patients. What do you need at home while recovering? That's next on MedTalk Health Talk, where your health comes first. Stay with us. During these challenging times, when COVID-19 cases are on the rise in Metro Manila, we should be more vigilant, more mindful of health and safety protocols. I'm Dr. Freddy Gomez, and you're watching MedTalk Health Talk. As we've been saying, home care is an option for some COVID-19 patients, specifically for those who are asymptomatic or those with mild to moderate symptoms. Ngayon naman, papag-usapan natin what do we need at home to make sure that we are able to properly care for someone with COVID-19. At una sa lahat, your temperature is one of the first things that we have to monitor, plus that oxygen level. Dr. Marivic, pag-usapan natin ito, how often should we check a patient's temperature?
Oftentimes, yung mga pasyente, kung meron silang thermometer, usually tinitake nila yung temperature nila oral or per axilla, no? So kung oral, as is, kung ano yung nabasa ng thermometer, or kung per axilla naman, we add at least 0.5. Meron naman din mga thermometer ngayon, yung parang binabaril ka lang, so nakikita din yung temperature doon. So temperature, like for example, if the patient is febrile or is developing fever, we consider giving paracetamol or antipyretics kung ang temperature nila 37.5 and above. And mas maganda kung ma-monitor yung temperature nila every 4 hours, lalo na kung sila ay naglalagnat. At dapat i-record din yung kanilang temperature para yung doktor na umaalalay sa kanila makikita kung talagang nagpo-progress yung condition, tumataas yung lagnat, or nagre-respond ba doon sa antipyretics. Importante yun na nare-record.
But also important is the knowledge to know the difference between moderate and severe symptoms. Because once na nag-progress ang simptomas natin, kailangan na talaga na pumunta ng ospital. Dr. Cindy, how can someone who is in home isolation know, or what could be some of the symptoms that could make them seek further help from a hospital?
Of course, the typical symptoms of COVID-19 of fever, a little body aches, no, that's expected. But in some instances wherein they develop difficulty of breathing, nahirapan huminga, there is some chest discomfort, no? Parang mabigat sa dibdib, parang may lump minsan sa throat, yung hindi sila masyadong makakuha ng air.
Dr. Marivic, it's very important also to know what type of symptoms, especially the severe symptoms, that someone needs to go to a hospital. But for the majority of people affected with COVID-19, those in isolations, mas madalas ba na mapupunta sila sa severe or critical stage, or namamanage ba ito ng madalas sa bahay pa rin?
Well, depende rin sa risk factors ng patient, ano? Since we know that majority of cases of COVID-19 are actually mild and even asymptomatic, so meron lang talagang mga groups of patients na kinoconsider natin ng mga high risk, lalo na yung may mga comorbid conditions like obesity, hypertension, diabetes, coronary heart disease, at yung may mga immunocompromised states. So yun yung mga kailangan talagang medyo bantayan ng mga pasyente, lalo na of course yung mga elderly individuals.
Eating well is also a priority for anyone, but more so for a patient with COVID-19 when your immune system is already compromised. Proper nutrition or hydration is very vital at this point. Now, Dr. Cindy, what should your day-to-day diet need to look like for someone who is in isolation?
It should be a balanced meal, no? Especially if you are a COVID-19 patient or recovering from one. You should have always some regular exercises that you do. So not necessarily getting out, but do very important breathing exercises, no? And that would help, recover, from the disease.
Yes, very important to really eat healthy and exercises as well as those breathing exercises as mentioned. Now, some doctors will suggest or recommend taking supplements. Let's discuss the different types of supplements that can help. Dr. Marivic, ano-ano ang ibang vitamins na makakatulong?
Of course, may mga benefits ang mga supplements na to. Like for example, yung zinc na pag-aralan na effective siya sa common cold, na babawasan niya yung duration of symptoms. Pero syempre, iba ang SARS-CoV-2. And walang pag-aaral tungkol sa SARS-CoV-2 about the effect of zinc, or kung meron man ay hindi masyadong mataas yung level ng evidence na ibig sabihin talagang kailangan natin siyang i-prescribe sa ating mga pasyente. Pero syempre, if the patient, for example, or if the doctor sees that this patient could be deficient in these vitamins, it would help also to prescribe these vitamins.
But what is important, I think, that our viewers should know is to be careful of medications that can. So what are some of the don'ts that people should be mindful of whenever they are in isolation when it comes to taking medications?
Okay, we really don't advise them to take medications that are not prescribed by their doctors. No? They have to consult their doctors, whether it's something that they encountered in social media or something recommended to them by a friend. They should consult first with their doctor because they do not know what the possible effects of these medications can be on them, especially if they have other medical conditions to consider. And I think it is really important to read and to look at references before you self-medicate on any of this medication. Again, as doctors, we always look at evidences before we prescribe anything to our patients. And we consider their general condition and other comorbid conditions, because all of this can result in side effects, more serious side effects from these particular drugs. That's why it's important that they consult either through a telephone call to their doctor if they cannot go to the hospital, or they can also do telemedicine.
Very good points. We're together in healthcare. You're watching Med Talk Health Talk. Coming up, they say to see is to believe, but you can't see the germs that can cause your different illnesses. How do you keep our homes clean to protect us from the invisible enemy? More when we return. Stay with us on CNN Philippines. Welcome back to the program. I'm Dr. Freddy Gomez. Whether you're on home quarantine or isolation, your home must be your sanctuary, your safe place. But often, we don't realize the viruses and bacteria that are lurking. Now, Dr. Cindy, ano ba itong mga high-touch surfaces? Remind natin mga viewers ulit.
High-touch surfaces are your doorknobs, windows, handrails, in your stairs, what else? Tables, chairs, no? So these are high-touched areas. So it has to be properly cleaned, no? And whether there is a individual who is on home isolation or quarantine, kahit wala yun, we still have to be very vigilant, no, on cleaning these particular surfaces.
Yes, and when we say sanitize or wash those high-touch areas on a regular basis, let's clean surfaces first with soap and water. Hindi kailangan na sobrang mahal dito, no? And next, sanitize with cleaning solutions. And in fact, you can also make your own. One formula is to mix 1 part bleach to 9 or 10 parts water, and you can use that for surfaces and floors. Just a warning though, whenever you're handling bleach, always make sure it doesn't contact your skin because it can be irritated, and never mix bleach with vinegar. Now, Dr. Cindy, what should someone understand or what should they know when handling someone in isolation at home?
Of course, what is important is communication as well to the other family members, no? Kasi most often than not, syempre medyo nalulungkot na yan, nade-depressed because they're alone, in their rooms, no? What is important is, a constant communication with them of what is happening inside the room. May text naman, no? They can even video call at this particular point in time, no? I think during this period that you have patients on home quarantine or home isolation, you really have to have an access to your doctors, no? Kasi as we have been discussing, no, there are a lot of news about certain drugs, certain maneuvers that you could try to prevent, complications from COVID-19. But, the best person actually to ask is the doctor. So sana yung accessibility, no, to your physician should be there so that you'll be properly informed of the things that you have to do in case, no, there will be some changes in your status.
Yes, I think that's a good point. And speaking of accessibility and communication, Dr. Marivic, is there a way that those in isolation or in quarantine can maximize how can they communicate or access their doctors this way?
As an organization of family physicians, the Philippine Academy of Family Physicians, we have this Facets program, which we actually started last year pa, nung nag-start itong COVID, no? The Facets is family and community engagement through telehealth service. So sa pamamagitan nitong programa nito, nag-offer kami ng free teleconsultations for everyone, no? And we're using a telemedicine app. We have partnered with Easy Consult. This is a telemedicine app. So patients can download the Easy Consult app through their Google Play or the App Store, and they can sign up. And from there, they will see a button that will lead them or give them access to PAFP family physicians. So when they access the button, they will be able to see our doctors who offer free consultations. Meron din namang mga paid consultations. So it depends on who they want to see, whether they like to have a free consultation or not. And every day we have an available doctor for free consultations. Sa pamamagitan nun, makakatulong din kaming ma-monitor yung mga patients na nasa bahay. And actually, in-encourage nga namin na kung maaari, sa bahay na lang muna, lalo na kung mild cases, no? Dahil ayaw nating ma-overwhelm yung ating health system na alam naman nating mahahaba na ang pila sa emergency room at natatakot din rin ang ating mga pasyenteng pumunta sa ospital dahil baka doon pa nila makuha ang COVID-19 kung meron naman silang mga symptoms na maari namang hindi rin COVID-related.
Yes, it's always good to know na meron tayong pwedeng kausapin kapag meron tayong hindi sigurado o hindi alam. And aside from good communication, again, constant hand washing is very important. And please, please keep your hands away from your face. Don't touch your eyes, nose, and mouth at iwasan natin yan, syempre. These are just the many steps we need to take to reduce the risk and stop the spread of COVID-19. With that, we'd like to thank our guests for today, cardiologist Dr. Cindy De Lara and family medicine specialist Dr. Marivic Pilares Cruz. We're so glad you could join us on Med Talk Health Talk here on CNN Philippines. Until next time, I'm Dr. Freddy Gomez. Thank you for watching.